Hey, this is Rebecca Hart here at Faith, Hope, and Wellness, and today we'll be discussing Lyme disease. So, Lyme disease, where does it come from? It comes from tick bite. 50% of the population does not have a erythema migrans rash, which is an EM rash. So a lot of people, do I have the bullseye rash? Not everybody does. So they can have different symptoms with Lyme. So that's what we're going to be discussing today. So Lyme symptoms, and some people can have all of these, some people can have some of these, and so you don't have to have all of these. So depends on where the Lyme and the spirochete is actually involved in the body. So you can have unexplained fevers, night sweats, chills, fatigue. So a lot of people come in with chronic fatigue. Now, chronic fatigue is a big one. It can be anything. So you'll see that a lot of these can mimic other diseases and things like that. Now, joint pain can be a hallmark for Lyme. And with joint pain, you can have wandering arthralgias, meaning that your elbow may hurt today, your wrist hurts tomorrow, so it travels. Also, a lot of neck pain, neck stiffness, chest wall pain, costochondritis, those type of symptoms. Bladder pain, so people that have interstitial cystitis, bladder irritation, that can be another one. Heart palpitations, so you can have Lyme myocarditis, inflammation of the heart, stiffness of the neck, stiffness of your back, muscle cramps, headaches. A lot of people complain of a lot of head pressure or head tightness, lightheadedness, POTS type symptoms, so positional orthostatic tachycardia syndrome. So POTS, where you sitting and you stand up too quickly and your heart races and you feel like you're going to pass out. Tremors. Those can be internal vibrations or external vibrations, meaning you actually see the tremor. Confusion, disturbed sleep is another big one. Mood swings, irritability, blurred vision. So a lot of people do come in, I'm seeing more floaters, or I have a lot of blurred vision. I feel like I'm looking through a fogged glass. Tingling, numbness, paresthesias, and they may not just necessarily be your fingers and your toes. It can be your chest or your part of your face. Difficulty with concentration. So these people have difficulty concentrating. They do have increased vertigo type symptoms and dizziness, and a lot of people complain about their ears ringing or tinnitus. So these are just some of the symptoms that occur with Lyme disease, which again occurs from a tick bite. Again, Lyme disease is a spirochete infection, and it occurs after a tick bite. Now, it can be an acute Lyme infection, which happens 4 weeks after being bit by a tick, or it can actually be a chronic Lyme infection. Just recently, chronic Lyme disease was recognized because recently of chronic COVID. So there is such a thing as chronic Lyme disease, where the infection has been stealth, it's been hidden, and something like COVID comes along and decreases the immune system and then brings the Lyme symptoms out. So these are some of the symptoms. This is some educational tools and Dr. Horowitz came out with a questionnaire that looks at all these symptoms. These are just some of them, not all of them, and did a wonderful job of compiling it all together so that we can have a better idea of who to screen for vector-borne illnesses like Lyme and co-infections. So hope this helps a little bit clear up some things, and then again, you may have more questions. So we here at Faith, Hope, and Wellness do treat Lyme disease, and so we look forward to talking about another co-infection next week, or we can delve a little bit more into some more Lyme symptoms. So hope you're having a good week, and we'll talk to you soon.